Hi, Career Sighted. I'm Dr. Warren Line. I'm an ear, nose, and throat doctor, or an otolaryngologist. A lot of people think of ear, nose, and throat as a form of general practice because we really do treat everything ranging from ear problems, hearing loss, chronic infections, sore throats and snotty noses. The least glamorous parts of my specialty are earwax and snot. I see a lot of that every day. And some of us treat more complicated problems like allergy or head and neck cancer. A lot of people don't know we're surgeons. Maybe you've had your tonsils out or had some ear surgery when you were a little kid. We're the type of doctors who do that. We operate on very important structures in the head and the neck, structures that can affect your ability to speak and hear and swallow. We're in the office usually 4 or 5 days a week, Monday through Friday. Often we spend 1 or more days a week in surgery. We have to cover emergency calls on evenings and weekends. A typical day for an ear, nose, and throat doctor, well, for instance, what I'm doing tomorrow. I have surgery at 7:30, and then I'm assisting my partner with an operation after that. I have some meetings at the hospital at lunchtime, and then I spend the entire afternoon seeing patients. We have a pretty busy practice. We'll see 25 to 30 patients in an afternoon. Then I got to finish up the paperwork at the end of the day. We work till 5:30, 6 o'clock at night. Only about 1% of all doctors are ear, nose, and throat doctors, although 25% of the average general practitioner's business is ear, nose, and throat problems. You can practice this anywhere in the country, anywhere in the world. The training is pretty consistent, certainly throughout the Western Hemisphere and in Europe. The career path does begin in high school. You got to be a good student, you got to be pretty organized, you got to be responsible. After I finished high school, I spent 4 years in college. In college, you generally start out as either a biology major or a pre-med major or maybe a biochemistry major. But it's really important that you have a human side to you too. So taking classes in the humanities is really important. And then I went to medical school for 4 years. The first 2 years of most medical schools are spent in the classroom, learning anatomy, learning physiology, and learning pharmacology, things like that. The next 2 years are the fun 2 years because then you get to go out and actually take care of patients and learn how to take care of patients. After medical school, did 1 year of internship and 4 more years of residency. You basically trade your 20s for job security. Healthcare is one segment of our economy that's really growing. There's a lot of job opportunities. It's a good field to go into. The reason you go into this business in the first place is because you genuinely want to help people. After 30 years, that's still the best part of it. Thanks, Career Sighted.